So dental problems are a very common finding. They're often not the original reason that animals are brought into the clinic. They're often things that are picked up just on a routine examination, because unless you're checking the animal's mouth very regularly, it's not always something that you're going to notice. And pets are very stoical when it comes to pain and dental pain, so they don't always let us know that there's a problem. So it's something that we check when they come in for their routine examinations, vaccinations and the like. So it's often then something that we need to have a chat with the owners about, because it may not be something that they were expecting for there to be a problem. But in older animals in particular, it's a very, very common finding. So when they're booked in for a dental treatment, they come in first thing in the morning. So when they make the booking, they're given a time and the nurse will do the admit. And at that point, they'll go through a couple of questions, things like, do you want to do a blood test before we start, which can often be sensible in older animals to check for things like liver and kidney problems. Then they'll be admitted. We'll obviously do the blood test, make sure that's all okay. And then we give them the anaesthetic. We give the teeth a really good clean, just the same as a hygienist would do at the dentist. We do a series of dental x-rays to have a look at the roots of the teeth, and we use a combination of the dental x-rays and probing to assess the teeth. Anything that's beyond the point of no return and a cause of pain, we'll then extract those teeth and potentially put some stitches in the gums depending on the type of extraction that's been used. Once we've done all of that, obviously we make sure that the teeth are now nice and clean. We give them some pain relief and possibly some antibiotics, and then they go into anaesthetic recovery when we give the owners an update, let them know how things have gone. I will usually then in the evening, if there's been any extractions and the animal's going home, go through the x-rays with the owner so I can show them which teeth have come out and why they've come out and what those underlying problems were, and have more of a chat about home care and prevention and what can we do now that we've got a nice clean teeth, how can we keep them that way and prevent the need for further dental work in future. So it really depends on the animal. Genetics plays a big part. Diet plays a part as well, so in some animals certain types of dry food may be better, or animals that are getting things to chew on, and home care plays a big part as well, which is brushing teeth, and there's various dental chews and dental biscuits and water additives and all of those types of things available. There is nothing better than brushing, and all of those additional diets and home care measures are not as good as brushing, but they're better than doing nothing at all. What that means is it's really important to check them regularly, so we recommend usually doing a dental check at least once a year, and that's usually at the time of vaccination. So it's not always that easy to tell. Sometimes you will get unpleasant smells from their mouth, or they will have bad breath. That's very common with dental disease, but there are other possible causes as well, which is why obviously the main thing really is to get them checked if you're concerned. They can sometimes show signs of pain, but it's not always that obvious. Sometimes they'll have more difficulty eating harder foods, or they won't be as interested in chew toys or treats. But a lot of the time they can be in quite significant pain and not really show us anything that's a sign to be concerned about, so we can't rely on that. But certainly that can be an indicator, and some pets are more sensitive than others. But I think the smell is a big one, and just lifting the lip and having a look at the teeth, and can you see nice shiny white teeth, or is there brown tartar on there? And do the gums look red and inflamed, or do they look much the same as the rest of the gums in the mouth?